Hey, good morning, and welcome to the UroPatient podcast. I'm your host, Vic Sinise. Welcome to the show. We meet here every Saturday at 10:30 a.m. And if you're watching us live on YouTube or Facebook, glad to have you on board. You can learn more about the show by visiting us at UroPatient.com, the best place to go to learn more about our show. Also, you can find all of our past episodes. Remember, this was created for you, the patient out there. I also created all these helpful handouts. Every time I have an episode, I've got a handout to go along with those episodes. You'll find them helpful. Check them out at any time. They're there for you guys. But we're going to talk today about the actual pharmacologic treatments, the pills that have been available. And they're by far, the PD5 inhibitors have been the number one drug in treatment. And that all started with the little blue pill called Viagra. In 1998, it was approved for the treatment of erectile dysfunction, sildenafil. It was originally used as treating blood pressure issues, and suddenly these patients were complaining that they were getting erections all the time. And somebody said, there's a good idea. Let's see what that's all about. The next drug to come out was vardenafil in 2003. It was approved, and it comes in two different forms, the Levitra and the Staxin. Levitra being another pill form, and Staxin actually having a unique property in that it's a dissolvable pill that you could put under your tongue or dissolve on your tongue. And the thought is it may get into the bloodstream more quickly that way. In 2003, tadalafil or Cialis was introduced, also with a unique property in that it has a very long half-life, which allowed it to be a pill that you could take once a day and kind of be like the ever ready bunny, always ready to go. And then in 2012 is the last one that's come out, and that's called vardenafil. And that's the generic name. It's Stendra's their regular name. All these drugs do have two things in common. When they came out, very expensive drugs, $14 to $20 a pill. And remember, this was back when they were first introduced. So, imagine what it would have been in today's day and age. And the other thing is, except for Stendra and Staxin, they're all generic now, which is a great thing for patients because somebody had told me you can go on that GoodRx site and you can get, I think it's the daily Cialis, the tadalafil, the generic, for like $1 a pill. So it's very inexpensive to use nowadays. So how do these work? Well, penile erection is mediated by nitric oxide and cyclic GMP. Before everybody falls asleep, I've got nice pictures to make it easier. So this is how I like to envision things in my head. I need to have some kind of visual cue. So when a stimulus, excites a person, the nerve cell starts to secrete or push out the nitric oxide. Nitric oxide then activates the soluble guanylylylase, which then causes the rise in cyclic GMP, and that causes relaxation of the blood vessels. Blood flows into the penis. And if you look at the picture that I have here, you can kind of see the arteries as they start to expand can push against the veins. So you have an increased flow, a decreased outflow, and there's an erection for you. Now, why does the PDE5s work? So the activity of cyclic GMP is modulated by this enzyme called phosphodiesterase. And in particular, there's a lot of 5 found in the penis. So again, I like making simple things for me. I hope it helps you guys. But the way I look at it is erection's kind of a balancing act. You have your nitrous oxide, cyclic GMP on one side and the PDE5 on the other. If you change the balance, all of a sudden you've got an increase in nitric oxide. It drives that system and you have an erection. Of course, if there's a lot of PDE5 sitting around, then that erection may not occur. And that's why we then prescribe the pills for the patient to take their inhibitors to get rid of that extra PDE5. And that's exactly what it does, thus the desired effect. So I hope those visuals were good for you. Only way I can keep this stuff straight in my head. Now, some precautions. PDE5 inhibitors should never be used with organic nitrate medications. it can really just about knock your blood pressure to nothing. And nitrite drugs include the following list. So they say anybody who carries nitroglycerin around in their pocket should not be on a PDE5 inhibitor. And these other medications that are taken on a regular basis should not. And then, of course, the illegal drugs like the alkyl nitrates, they're poppers. Again, they should be warned. Now, I think patients need to know all that too. It's important not to assume that everybody's not using these illicit drugs. Cialis, Levitra, and Staxin and Stendra should never be taken if you have severe liver impairment. Levitra, Staxin, and Stendra are contraindicated if you're on kidney dialysis. But Viagra can be used in both this population, but at the lower dose, the 25 milligram dosage. Dosing guidelines I put here for you. As you can kind of see, most of the medications have about a 4 to 5 hour duration. Stendra's unique difference was it has a longer duration, 6 to 12 hours. That doesn't mean a 6 to 12 hour erection. That just means that you can obtain an erection during that time. None of these drugs work without sexual stimulation. So they just, again, as I did with my diagram, they take the PDE5 out, but you still need a nitric oxide increase to cause an erection. Cialis, again, as we mentioned, with the long half-life, 24 to 36 hours. So you could take a low dose of the medicine and it'll keep building up over time to reach a steady state of, say, 10 milligrams. Most of them are taken about an hour before sex. The Stendra supposedly works a little quicker, so 30 minutes before sex. And again, Cialis can be taken once a day. Cialis is the only one that is used to treat BPH, I think because of its once a day ability. So 5 milligrams once a day can treat both erectile dysfunction and BPH. Now, I know we had some talk about this, so I looked up an article on modifications. Somebody had said, basically in general, PDE5 inhibitors are contraindicated with alpha blockers. So somebody that may be suffering from BPH could be a good candidate for Cialis for that reason. But I did find some adjustments and modifications that are suggested that I think could help out here. So Viagra, you can start with the low dose if taking alpha blockers and increase it under the direction of your practitioner. Cialis should be limited to daily intake of 10 milligrams for mild liver impairment and 5 milligrams if on kidney dialysis. The daily should not be increased beyond 5 milligrams per day for BPH. Levitra and Staxin, you can decrease to 5 milligrams for males over the age of 65 and increase only under direction of your healthcare provider. Decrease to 5 milligrams daily, never to exceed 10 milligrams daily if you have mild liver disease. And finally, Stendra, decrease to 50 milligrams if taking alpha blocker and increase under the direction of your practitioner. You're watching for blood pressure issues. So side effects, common side effects include headache, dizziness, flushing, upset stomach, nasal congestion, muscle aches, nausea, back pain, and bluish visual disturbances. It says mainly with Viagra. I don't think I've ever had a patient complain with any of the other drugs. And I've only seen a few patients that had the blue vision with the Viagra, but it has been, there have been several patients I've had note that. Most common one I hear is the nasal congestion and the headache. So, and I've told patients they can try taking Tylenol with it and see if that'll help the headache. And some have reported that that was all they had to do and it was fine. I've never seen dizziness, but it makes sense that with the orthostatic hypotension that could occur, that might happen. Flushing, more common than upset stomach. I've never had a patient complain of. I haven't had anybody complain about nausea either. Severe side effects. We always warn patients that any erection lasting more than 4 to 6 hours should be considered a medical emergency. They should report that to their physician, probably report to the emergency room. This other one's more important. Sudden vision loss can be related to something called eye stroke. So again, if somebody reports a sudden vision loss, that's a medical emergency. They need to seek emergency care. And sudden hearing loss is another possible side effect. again, they should seek medical attention for that. So I hope you enjoyed this episode. We'll see everybody next week on UroPatient.com.